Well, Michael Jackson's death last week shook and rattled the world. Many people are anxiously awaiting toxicology results to see if it reveals any clues into his unexpected death. We do know that he died of cardiac arrest, but what we don't know is what caused that. There's speculation of too much stress from his upcoming tour, as well as prescription drug abuse. Joining us this morning to talk more about the situation is Dr. Michael Gurule, and he's a cardiologist with Cardiac Care Consultants of New Mexico. Thank you so much for getting up early and joining us. So when you talk about cardiac arrest, you told me you kind of break it into two areas.
Yeah, I think with the heart, with my patients, I try to describe it as an electrical problem and a plumbing problem. And cardiac arrest, basically, in its simplest form, just means that the heart has stopped. And the question is, how did it get to that point? And most people are usually familiar with the usual heart attack sequence because they've got a family member, somebody that they know, maybe personal experience, where the heart actually had actually stopped because of a plumbing problem. That's your standard heart attack. It's a blocked artery. Arteries are blocked because of cholesterol, smoking, diabetes, high blood pressure, these ongoing things that we all talk about. But then there's that other component that people are not as familiar with, and that's the electrical aspect of the heart. The heart also has an electrical thing where it can actually slip out of gear, so to speak, into an arrhythmia, and these arrhythmias can oftentimes be lethal, where they're not able to maintain the heart in a normal pumping ability, and the heart essentially stops. So you can get a heart attack from a plumbing problem, you can get it from an electrical problem.
And in this situation, your thinking is probably more electrical just because of some of the other factors going on in Michael's life.
Right. He didn't seem to have any of the usual risk factors for heart disease. He didn't seem to have the family disposition, some of these other things, cholesterol, diabetes. And so you start thinking of more of an arrhythmia thing, also because of the fact that this occurred in a sudden type of fashion. There's obviously speculation that there may have been some drug abuse. That's typically seen in the more electrical arena. Where basically the chemistry of the heart is altered, and that's what throws the heart into this electrical
What about stress,
rhythm.
though, in this situation?
Well, stress throws gas into everything. I mean, it generally can precipitate this as well, but, you know, commonly there usually is an underlying disease, and so stress is kind of interesting because, you know, people come in and oftentimes talk about stress, and so stress can do two things. It can either masquerade as real disease, or it can actually bring out real disease, and oftentimes you don't know which one is occurring. So we always usually include stress as kind of a diagnosis of exclusion. Let's figure out the problem, and if we can't find anything else, well, then maybe we can say there was a stress component to it. One
thing that's happened is that this morning they're reporting he had a slight pulse when this family doctor found him. Does that give you any clues as to what happened?
Well, it does, because it tells you a little bit about the sequence, and that actually tends to play into the earlier point of it being more possibly drug-related, because when the heart stops, generally everything stops. The question is, what came first? Did they, you know, a young kid could get in a car accident, could bleed, and eventually everything's going to stop. The lungs, the heart, everything. In this case, it's interesting that you bring that up. They described how his respiratory, his spontaneous breathing had essentially stopped, but yet they were still able to get a faint pulse. So what that is inferring is that the breathing probably went out first, and that there was some type of a remnant pulse, meaning the heart was probably still going. So it hadn't quite stopped yet, but it sounds like the sequence was breathing, and then the heart actually stopping its pump.
Well, thank you very much. Really appreciate you getting up this morning, and we learned a lot through that.